County, where it came from, and a little bit about where it is right now. I am a recovering banker. Mindy is a recovering newspaper person. She still uses her Facebook page to keep us up to date on all the news that's going around. I'm Executive Director of Williamson Medical Center Foundation, the fundraising arm for Williamson Medical Center. The foundation does not own the hospital. I'm also an elected county commissioner. I'm a former city alderman with the city of Franklin, also elected position. So I've been involved in various ways in the community since about 1990. I chair the Convention and Visitors Bureau Board, and I'm also on the Williamson County Chamber Board, the now unified One Williamson County Chamber. A very big step for us, and one we're very excited about. Williamson Medical Center was established by resolution of the state legislature in 1957 as Williamson County Hospital District. Prior to that, what we had in Franklin, with a population of what back then, 5,000? Yeah. About 5,000. We had private clinics owned and operated by physicians. We built a hospital in 1957 with federal Hill Burton funds and some state funds and perhaps some local funds. We currently are in a location close to the interstate. We moved there 30 years later at about 1986, 87. We're a 185-bed acute care medical center, county owned. Only medical center in a county of now about 175,000. And we don't do a few things. We don't do open heart or open brain, those sorts of things. We do most everything else. Just a general acute care hospital. The gentleman from Piedmont talked about their facility. We've got about 1,500 employees, about 500 physicians on staff, 50 or so medical specialties. We were the first non-urban hospital in the country that we were aware of to have the Da Vinci surgical robot, and now we're on the second edition of that, and those things are expensive. But we have a very active, very high-quality medical staff and do a lot of surgery for our size. We're not your typical county hospital. We do not, nor have we ever relied on tax subsidies to operate. We pay our own way, and always have. The things we don't do, open heart, open brain, those sorts of things, we're 20 miles away from an academic medical center, 2 or 3 other tertiary facilities, and either for-profit or non-profit facilities. Economic impact, we're the 3rd largest employer in the county. I'm going to run through this pretty quick and cut me off if you need to. We believe we are, and we certainly aspire to be, a high-quality, low-cost provider. That's something people around the country are striving for. That's driving medicine right now, and I'm not going to talk too much about data, but as in school systems these days, healthcare around the country is driven by data. You collect as much as you can, as often as you can. It's reported now, so you can't run from it or hide it. It's public, and so those are those data points that are measured are things that you're targeting every day. We're a certified chest pain center, certified cancer center. Again, back to the gentleman from Piedmont, our accrediting body, Joint Commission on Accreditation of Hospital Organizations, showed up yesterday morning. So it's kind of all hands on deck yesterday and today.
Good thing you can be here.
Yeah, yeah. Being non-clinical has its advantages. Uninsured, I would probably, in terms of our budget, our financial statements, we take care of about 6 to 8% of TennCare, which is our state Medicaid program. That's actually a larger proportion than our resident TennCare population. So we have folks coming in from other communities to visit our hospital for that care. Under our founding and throughout our history, we have a history of treating anyone who comes through the door regardless of their ability to pay. That doesn't mean just stabilize them and send them somewhere else. That means we take care of them as long as they need treatment. We cooperate locally with several clinics who treat lower income or uninsured. They typically have to have an agreement with us for their certification process to be able to take care of patients. We do provide some free or discounted services through those clinics, in addition to the uninsured that we treat coming through our doors. We also we provide the physicians on our payroll to the Williamson County Health Department. There are a couple of different locations where they have facilities that treat patients. We provide those physicians on our tab. We're the only county and state that we're aware of that has that situation. And we partner with the county in a joint agreement to provide the ambulance service for the community, the EMS service. And we also provide the training for the other first responder services around the county. Real quickly, partners, we'll get into this a little bit more in a minute, but you're seeing this occur throughout the country, but we have an affiliation agreement, a strategic alliance, if you will, has been in place for about a year with Vanderbilt and 4 other community hospitals around Middle Tennessee. We expect that to grow into other facilities, but we'll provide a network, eventually a integrated care network to Middle Tennessee, and we're very excited to be a part of that, and it's bringing a lot of opportunity for us. And the other facilities that we're partnering with. We've got an interesting situation here in Williamson County, the attractiveness of the quality of life. We've got a lot of doctors who are on Vanderbilt's payroll. We have physicians who are on our payroll. We have physicians who are on St. Thomas's payroll that all work at our facility, and independent physicians. There's still plenty of those out there as well. So we have a real mix of medical staff at our facility. In terms of the community, we think we do a really good job of community outreach. We've got a very strong marketing and PR department. We do health screenings at various communities around various companies around the county. We'll do about 5,000 flu shots through various employers around the county this fall. That's something we do in cooperation with them. We have very close relationships with our local, state, and federal elected officials. Let me just point out the banner that you see on the table in front of you. That's kind of the Back to the Future communication piece for us. We went through several years ago a switch to e-newsletter, web page, Facebook, Twitter, all those things, all those ways to communicate to the younger, newer digital population. We found there were still a lot of gaps in our communication to physicians, employees, and our community. And so while we're still doing those other things, we're going back to old-fashioned piece of paper that you pick up, and to see if we can eliminate some of those gaps and communicate better. Glad to have you all here. We're proud of what's going on in Williamson County, and appreciate y'all being here and being interested, and thanks for the time.